Lindsay, let's talk allergies. This is the season. What exactly is an allergy?
That's a great question. An allergy is just your body's immune system overreacting to an otherwise harmless substance. So if a cat dander gets into your body and you're allergic to it, your immune system attacks it and causes symptoms.
And if you don't have allergies, you don't realize how terrible they can be. And it's something that you really don't have to suffer through. You can take care of this. What do we need to do? How do you get tested?
To get tested, there's really two reasons to be tested. One is just to know what you're allergic to see if we can give you ideas on how to avoid them, or an idea of what medications and when to take the medications.
Okay, because there's a lot of different things that cause allergies, and so you've got to find out what is causing my allergies or my son's, and you do that by?
The way that we test is we have about 60 different common allergens from the area, and we take just a little tiny bit of it and put it right underneath the skin and then give it a few minutes, and if you get a hive, then you're allergic to it. The bigger the hive, the more allergic you are.
Isn't that interesting to think that you're going to put that in there and then be able to see? I wouldn't have any reaction to it if I'm not allergic.
Correct.
Okay, very good. Well, what are some of the common allergens that we have here in our area?
There's seasonal allergies, which we have a list of aspen and birch, common trees, common grasses and weeds in our area. And then there's also perennial allergies, which are everywhere and are all year long. And those are house dust mites, animals, and molds.
So I hear about those things all the time, but again, I've not been affected. So I see my son out mowing the lawn, and he'll come in and have kind of a puffy eye. It's gone within a couple hours. But some people just can't even get up and go to work. I mean, it's that terrible for them. Tell me what we need to do to make our lives, if you're suffering from that, better.
Well, come in and see us, because the other reason to get tested is exactly what you mentioned. People who allergies ruin their lives or greatly interfere with their lives, and those are the people who they've tried avoidance, they've tried medication, the over-the-counter medication, and they still don't have relief.
Well, you would think that, okay, I'm just going to run to the grocery store, buy my little antihistamine or whatever it is, spend my $20. Well, really start here, save that money, and get exactly what it is you need. Now, you offer some therapies whether it be medicine or tell me a little bit about the therapies.
Sure. The third treatment option for allergies, it's called immunotherapy, commonly known as allergy shots. And basically, what we do is we test you, see what you're allergic to, and then each week you get a very small amount of what you're allergic to, and we slowly build up your tolerance level. And it takes some time. It is a commitment, but the results are life-changing.
See, that's a fascinating way to do it, is you're building up that immune using your own system's ability to conquer that allergy.
That's correct.
Okay, because we don't want to be on medicines all our life, but you might actually have to be as well. Again, if you're trying to control this allergy?
Correct. The immunotherapy, for the first year that you're on it, you still have to take medication because the amount we're giving you isn't enough to really desensitize you to the allergen. But after you go through that first year, then the shots get a lot once a month rather than once a week, and it improves your symptoms by 80%.
So that's a high rate of success there. That's fantastic. Okay, well, as far as insurance and things like that, is there help that way?
Definitely. Most insurance companies cover 80 to 100% of allergy testing and treatment.
See, I would not have guessed. Hallelujah. Right? Some bonus there with your insurance. Okay, so to get in contact with you, well, first of all, tell us, when should someone call you? How severe or slight should the allergy be?
Any hint of an allergy we can help you with. We can talk about medicine. Doesn't mean you have to do allergy shots. And one other thing is allergies, if untreated allergies, can cause more problems like chronic sinusitis, chronic cough, and it can actually turn into asthma. And so the earlier and more aggressive you treat it, the better.
Well, and I think that makes a good point too, because back to what we said, just don't run to the grocery store and second guess it. Right. throwing money here and there without knowing, that makes sense. Now, can kids be tested as well?
Absolutely. We can test any age, but we prefer to start the real aggressive treatment around 3 or 4 years old. And kids actually respond better than adults do, and it actually stops the allergic marathon or march where little babies start with eczema and then they get allergies when they're 3 or 4, and then later they get asthma. And immunotherapy can actually put kind of an absolute stop to that, but definitely improve the rest of their life.
Well, it absolutely makes sense to me. All of this makes such perfect sense. We need to get in contact with you. Tell us how to do it.
Well, we have a website. It's www.cashallergy.com, and we take all new patients, and you can call us at 753-7880.
And the Allergy Clinic here is really the only full-time allergy clinic in the Valley, and you're located in the Cache Valley Specialty Hospital at the Gateway Medical in combination with the ear, nose, and throat.
Correct.
Okay, well, Dr. Banyan's helped me with my thyroid, and now he can help us with our allergies. Lindsay, thank you so much for all the information.
Thank you so much.
Great.